video is not financial advice, so please do your own due diligence and see what you want to invest into. Today we're looking at Humanscape at humanscape.io, and this is the solution to incurable diseases by curating personal health data. There's a lot of people suffering from diseases that don't potentially have known cures yet, but they can find cures. Those people can be helped with the right data. And you can click the video here and watch it to get more information. Read the white paper, the one-pager, and as an announcement, their second pre-sale of Humanscape has successfully ended. The Humanscape second pre-sale sold at 3 different channels: official website, token bank, and coin manager, and has sold out with less than a day. Yes, sold out within less than a day. And they would like to thank all for their participation, trust, and love towards the project, and the Humanscape team will continue to work harder to make the goal of creating a healthy world a reality. And the sales schedule for the 3rd round will be announced soon, so please stay tuned. You can click here to buy. You also can click here to get on the whitelist registration and follow them on their various social media channels: Facebook, Twitter, YouTube, Reddit, and they've also been featured on ICO Bench, Track ICO, ICO Today, ICO Holder, and Find ICO. You can click here to learn more about the token sale, see their advisor. Bernard Lapp, former Ethereum Foundation advisor, joins Humanscape's advisory board, or click here to see an interview with ICO Today. And there's millions of people suffering from incurable diseases worldwide. There's 7,000 of incurable diseases, and 7 out of 10 lead to deaths. There's also economic loss of $4.3 billion to incurable diseases. There are still numerous people in pain due to many unconquered diseases at this moment, either from not knowing the exact cause of the disease and proper treatment, or their diseases just not being curable. Their suffering strikes a family as a whole, both psychologically and economically, and can end up causing astronomical social cost. That's why there's a solution. A key to the solution is patient-generated health data, or PGHD. Humanscape believes that systematically organized information from a good number of patients can be the solution to unconquered diseases. PGHD takes up to 60% of the total amount of health data. However, due to the lack of solid platform where it can be collected and organized in, it only exists in fragmented form. Humanscape aims to free mankind from all diseases by integrating PGHD into one source. So all patient-generated health data will be in one source to help fight these incurable and diseases that may not potentially have a known cure yet. Also, the benefits. Patients, they can get motivated to fight against their diseases by being highly involved with their treatment. Medical experts can gain valuable insights and provide precisely targeted treatment to each patient. And researchers can conduct efficient and curable disease-related researches such as drug development based on real data shared by patients. There's also the token economy of the patient-generated health data with the data set of PGHD, and then the HUM token, the HUM token, and the data set through pharma companies. And there's their application. What are some of the parts of the application? There's the personal health profile. Patients' personal health profiles, such as daily records of illnesses, associated symptoms, administrative medication, and IoT data, can be entered and managed altogether in Profiles section. And under Patients, permission, this data can be utilized for researches and clinical studies, ultimately bringing better chances for recovery. Then there's Community. Health records are shared by patients, currently scattered around different patient communities focused on certain diseases. They can be browsed in a single platform. The rarer the disease is, the less information is available, and in this respect, every little piece of information is valuable and can be a great help. There's also the Data Hub. When it comes to incurable or rare diseases, a relatively small amount of patient data can be still useful for pharmaceutical companies and clinical studies institutes to gather target patients and conduct researches. For example, in 2011, there was a case which existing medical research paper was refuted by 149 ASL patient data. So why the blockchain? People's health data should not be monopolized by a few and must be safely controlled and utilized in a transparent manner for public interest. And that's why patients' health data has been in the hands of third parties who tried to monopolize it and commercialize it. Thus, it was nearly impossible for patients to know to what extent their health record is being collected, who needs it, and how it's used. However, on the blockchain that provides transparent environment and data usage, anyone can look up transactions of the data, and ultimately patients can retain control and authority over their own health data. And we can see the roadmap here in 2018, the white paper publication, the company incorporation Hong Kong, Humanscape MVP development begins, pre-sale first round, second round, and third round, the main sale, the test group, Indonesia Corporation, the organization POC, and in fourth quarter, exchange listing, the MVP release, the alpha test, and POC with the pharmaceutical companies and contract health institutes. You can also follow Humanscape on their various social media channels here, or if you have a question, send them an email at support@humanscape.io. Thank you very much for watching this review on Humanscape.
Press the bell icon on the YouTube app and never miss another update.